Hello, everyone. Welcome to day 1.1. The instructor lecture today is covering the syllabus objective, distinguish ethical standards. There is no singular set of rules for ethics um, in any industry, in your life, in your religion, in your community. There are certainly ethical things overall, but if we're looking for a very concrete list, while they are extremely similar, and your Ethics of Touch book has a list, the ABNP has a list, the AMTA has a list, the FSTMB, who does your NBLEX, has a list, Canada has a separate list. Each state has a list separate from the FSTMB. And so we're going to talk about a little bit of overlap, all right, because there are many, many terms that you do see everyone repeating and several concepts, all right? So ethical standards of massage therapy. So I'm going to start with ABMPs, Code of Ethics for Massage Therapists, and you can feel free to pause at any slide. And just so that you're aware, at the end of each week, I will provide a PDF of all of the week's slides if you feel compelled to download them or if you want to use them as a PDF to help you answer some of the lecture questions that will be posted every day. That will certainly help you out. But I'm not going to read everything word for word because I have a ton of information here and nobody wants to sit here for 45 minutes. So I'm going to try to make this somewhat short and to the point, although we do have a lot to cover. I apologize. Sorry, not sorry. This is something you absolutely need to have a clear understanding of going into the massage therapy profession. All right, so what is a code of ethics overall? It's a set of rules and principles designed to encourage ethical conduct among a group of professionals, in this case, massage therapists. So the ABNP says commitment to high quality care. All right. You will serve the best interests of your clients at all times. That means you will not have self-serving interests. That's a conflict of interest. We'll talk about that later. Commitment to do no harm. You will see this described in your Ethics of Touch book as non-malfeasance. All right. As well as the AMTA talks about non-malfeasance. This is the commitment to do no harm. Malfeasance, meaning bad. Mal, well, we see mal in front of a word, it means bad, right? So non-malfeasance, you will not do bad. It's like the doctor's taking the Hippocratic Oath, physician do no harm. Commitment to honest representation of qualifications. You can't tell people that you're certified in things that you're not certified in. If a certain time has passed that you haven't practiced something, you can't tell them that you're certified in it and an active practitioner. I was certified in cranial sacral work quite a while ago, quite a while ago. And it's been about 10 years since I've really done a full body cranial sacral uh, workup on anyone. I still do it on the cranium and I do it in the mouth for TMJD problems, but I would never accept a client that was looking for someone that was certified to do full body work, especially for like their spine, because I haven't done it in so long. Um, I have all the certifications for it, sure, but I know that I don't practice it often enough at this point to be the best one to work on that therapist. I would definitely have to re-up my credentials and do some practicing. So you need to have an honest representation of qualifications. If someone is coming in and they're having pregnancy qualifications and you have not worked on a pregnant person before, you need to refer them to a prenatal specialist, okay? Commitment to uphold the inherent worth of all individuals, all right? We talk about diversity a bit in this class, equity, inclusion, and all that good stuff. You definitely have to treat every client with compassion and respect and to decrease discrimination in every aspect. I'm not going to wax poetic on this now. We are going to cover that in a moment. Commitment to respect client dignity and basic rights. You have to provide a clean environment, a comfortable one for sessions. All right, using appropriate and skilled draping procedures, giving clients recourse in the event of dissatisfaction with treatment, and upholding the integrity of the therapeutic relationship. We got some large people here in the Midwest. I would highly recommend using a full-size top sheet instead of a twin size sheet. Use a twin size or twin size extra long for your massage bed fitted sheet, but I would recommend something a little bit bigger for the larger folks that may come in so that they feel appropriately draped and there's less chance of something turning. It gives you a lot more material to tuck and move around as well. Another thing to take into consideration, aside from disabilities, because that's a whole other can of worm that we'll definitely cover in this class, but people that are extremely tall, people that have difficulty getting on high tables, people that are significantly overweight, in addition to having a larger sheet, you might want to make sure that your massage bed is incredibly stable, perhaps a little bit wider. Some of them, mine has detachable arms that you can stick onto the sides so that people that can't lay fully comfortably with their arms at their sides on a massage table can put their arms out. Excuse me. People that are really, really tall, you can buy your table longer. That'll fit like a 6.5-foot person, but you'll also have extenders for like the neck rests and things of that nature. So things like that, just keep that in mind to make sure that your office is clean, that your bathroom is accessible, that whatever client you may have will be able to access the table, be draped properly, and to be able to use the facilities if needed. Commitment to informed consent. All right. You don't just want consent. You want enthusiastic consent. You want them to know what you're going to do to their body, and you want them to agree to it in writing, all right, for your own legal purposes. You want this on your intake form, or you want to have a separate consent form. I do have a copy of one for you guys this week from the University of Michigan that you can take a peek at. Commitment to confidentiality. I had a student once that thought that HIPAA was just a suggestion. It is not. It's the law. You absolutely need to respect everyone's confidentiality. We're going to talk about that a bit more in class. This isn't just a don't release the name, the age, the address, and the ailments of your particular client. This is when you accidentally see them in a Starbucks or something or Walmart, you don't call them or like call out to them like, hey John, or hey Nancy, and then whoever they're with is like, oh hi, who are you? And you're like, hey, I'm their massage therapist. I treat their bursitis or something like that. Nope. You pretend that you don't even know them, just like you would casually be polite to any stranger unless they speak to you first and acknowledge the relationship. All right, that's all part of the confidentiality. Commitment to personal and professional boundaries. Ooh, we cover boundaries in chapter 1. We covered a lot in your Ethics of Touch textbook. Boundaries are important. You'll refrain from and prevent behaviors that may be considered sexual, but not just sexual, overly personal, invading someone's space, talking too much. There's a ton. ABNP focuses on sexual, but there's a lot of other boundaries that you don't want to cross in this therapeutic relationship. Commitment to honesty in business. You're going to follow good business practices. You're going to be compliant with any state, federal, and city regulations. Some cities heavily regulate massage therapy. All right, and tax laws. The IRS wants to know everything you made, even if you bartered buttons or goats for a massage. The IRS wants to know. All right, they want to know 100% of what you made for income, no matter what that income was, even if it was rolls of toilet paper during COVID. All right, commitment to professionalism. I will maintain clear and honest communication with clients and colleagues. I will not use recreational drugs or alcohol before or during massage sessions. Do not vape your pen in your office. Don't do it. Don't do it. And if you move to Ann Arbor, don't even microdose before you do something. Absolutely no alcohol. Not only does it smell terrible in your breath, these things do react with you and your inhibitions, lowering them quite a bit, and you might start making some bad decisions. You may not be thinking clearly. Aside from being against the law, in some cases, it is extremely unprofessional to do something that might be dangerous to your client because you're not thinking clearly. Okay. Also, it smells terrible in some cases, especially smoking. We can talk about smoking at another time, but please be aware people are allergic. Also, scented lotions. If we're going to talk about recreational drugs at this point, I'm going to talk about some of your, department store lotions and spray-on colognes. Just stop. Stop. It doesn't smell cute. You're going to give someone a headache. Abuse. We're going to go over some terms that are pretty common in here, and a huge concept when it comes to talking about massage therapy and thinking about abuse is that people think about clients sexually harassing massage therapists. And this is pretty common. It's mostly men against women, male clients against female massage therapists. It is reversed. All right. There are a lot of lonely older ladies that have been known to get quite aggressive in the massage room. They are mistaking what's happening in the massage room for intimacy because it is an intimate setting and you are getting your body touched, but not in that way. That is called transference. We'll talk about that later too. But in this particular case, we are talking about your ethics and you not abusing your client. Now, what does that look like? You're like, oh, I would never. I would never. Financial abuse. You might exploit the power differential between you and your client. Like you accepting gifts if they give you ridiculously large gifts, or if you borrow money from a wealthy client, becoming a trustee of a client's account, accessing their bank account. You're like, oh, I have a geriatric client that like can't figure out how to pay. They can't write their checks properly. So they just add you to their account. I believe it or not, it's happened enough that it's literally listed. Okay. These things are all no-nos. You don't try to benefit financially off of your clients, okay? Physical abuse, an act which may cause pain or harm to another. Slapping, hitting, pushing, and use of force during a treatment are examples of behaviors. Um, I do a lot of deep work on post-operative patients. That's incredibly painful. I apologize. That's why I'm laughing. I had one client that literally would show up to his appointments at the chiropractic office that I work through sometimes. And he was like, I'm here for my flogging. One of my favorite clients, but some of the work was painful. That's not necessarily what they're talking about, although even in those settings, you have to be very careful. We're going to talk about a concept called power differential. Okay. We're going to be covering that in depth because you are the voice of expertise in this relationship. And if you're explaining to a client something ridiculous like no pain, no gain, they may honestly believe you. They may walk in already feeling that way or having believed it, being told it by like a poorly trained personal trainer or something in the past. And they may be, oh man, like it's supposed to hurt, otherwise it's not working. That's not what massage therapy is, all right? You need to be able to exact therapeutic change without damaging your client. So this is something we can talk a little bit more about later if you so desire, but intentionally hurting them, right? Someone comes in, they make a nasty comment, and you start digging on them a little too deep. You know that you shouldn't be doing that. Retract the elbow. Sexual abuse. Obviously, you're not going to sexually harass your client, all right? You're going to go to jail. You're going to lose your license. Why would you even? That's so gross. No, absolutely not. It is a very intimate setting. Someone comes in that you find yourself insanely attracted to. Stop the session. Save your license and be like, hey, look, I just can't. just can't do this session. It's ridiculous. I'm a grown adult, but I can't control myself. Whatever it is, stop yourself before you get to this point. Make sure that you're not doing anything that the client could misconstrue either. We're going to talk about the concepts of professionalism and the way that you dress, the way that you look, unfortunately, can really cause the perception of something being sexual in nature, even when it's absolutely not. You may be dressed for comfort, and somebody else is like, oh my, there's a lot of skin showing or something along that nature. So we can cover this in more detail, and we definitely will under the helm of professionalism. But please be aware that there are things, maybe if you're joking, the client might think that it's flirting sometimes, especially if they're not used to having interactions with people of their gender of interest. You know, if it's a heterosexual man on the table and a female therapist, he may construe all of that intimate touch and you just being friendly and joking as sexual intimacy. So please be careful. And I always recommend having a sexual policy as well as a consent policy with your intake forms that the client signs before you begin the massage. Okay. Verbal, emotional, and psychological abuse. You know, they talk about working with lots of cultures and beliefs. It's important to recognize that personal remarks about their appearance, their behavior, um, their language, their religious practices, anything that can be construed as insulting. Behaviors even such as sarcasm, teasing, swearing, threatening them, even if you're jokingly threatening them, like, ooh, hoo, hoo, you better do your exercises or I'm going to use the elbow next time. That's threatening. It really is. It seems funny, but it's not. Don't do it. Psychological abuse includes the destruction of a client's self-esteem or sense of safety, often associated with differences in power and control with the massage therapist and client relationship. All right. This includes, of course, threats of harm, abandonment, humiliation, deprivation of contact. Hey, if you don't do this, I'm not going to treat you anymore. But we're not talking about you protecting your boundaries. We're talking about you telling a client they have to do something. Like you need to buy a 6 package deal of massages up front, or I'm not going to work on you at all. These are all interchangeable with psychological abuse, emotional abuse, verbal abuse, mental cruelty, and psychological aggression. Believe it or not, things like swearing really can negatively affect your clients if there's someone that's not used to it. They may find it very crass or offensive. Even what you're wearing, again, we're back to professionalism and what you're wearing. If you have a very religious crowd that comes in, you have you know, a particular religious sect that dresses a certain way, likes to remain fully clothed during massage, that type of thing. And if you're wearing like a very low cut scrub top, you know, maybe you're wearing it like one size too large, even like something that you think is totally normal, you're not meaning to do anything bad by it. It can absolutely insult your clients. So please just be aware of these things. Accountability. All right. Be answerable for the practice of massage therapy and act in a manner consistent with massage therapist professional responsibility. All right. Conflict of interest. This is when your personal or financial interest conflicts or appears to conflict with the exercise of their professional judgment or duty to act in the best interest of a client. Okay. This can be real or perceived. All right. You don't want to work on someone who is the vendor of your products. You don't want to work on your employer in some cases. Um, you know, things that could sort of be misconstrued. You know what I mean? You don't want to work on your bank teller or the manager of like your loan or something like that. Things that could affect your finances through your personal relationship with them. You don't want to do that. Consent. All right, consent. You need voluntary and fully informed consent, and they have to be able to provide consent. Remember that word that we have used in the past with 105 and 115, probably also in 135, talking about autonomy, someone's ability to make decisions about themselves and their own body. Autonomy, okay? A client must have autonomy, and you need to fully inform them of what's going to happen. I am going to press on your glutes if you'll let me. I am going to grab your feet if you let me. I'm going to grab your shoulders if you let me. All right, you need to tell them the nature of the treatment, like what modality you're using, what creams, oils, lotions you're using, the expected benefits. You can't promise benefits. You certainly can't say that you cure anything or fix anything. Risks and side effects. All right, alternative courses of action, that if we can't do something, this is an alternative thing that we could do. The consequences of not having treatment, as well as the consequences of having treatment, and make sure that they have the right to ask questions about all the information provided, and that their assessment or treatment will be stopped immediately or modified at any time at their request. All right. Consent for treating sensitive areas must be obtained in writing. I would say always obtain it in writing anyway, a consent to treatment form. That's just me. You probably don't want to come to my office. I have like 5 forms for people to sign. But I want to be protected legally. And as some of you have talked to me in the past, had me for other classes, probably know that I'm a nerd and I focus more on medical stuff. One gentleman that I saw as a client had a medication dispenser in his scrotum. He had had testicular cancer. The testy was removed, and then a medicine dispenser had been put in there in its place. And he had a lot of adhesions and scarring and stuff in that area, lots of scarring. And it was extremely uncomfortable for him, and everything would like tug in that area around that medicine dispenser. He was not my normal client. He asked me to look at it. He wanted me to work on it. I wasn't comfortable because it was like a one-time thing. He was like a family member of a regular client, kind of, and so I declined to do work on it at that point. But his regular therapist worked on it almost every week for him, and I understand why, but that is what we would definitely call a sensitive area. It's certainly not something that a newbie therapist is just going to jump in and do, and that is something that you absolutely have to have written consent form. And the purpose, he had a legitimate medicine dispenser in there, so you have a legitimate reason to work in that area at that point, but it needs to be documented so that you're legally safe. It's clear that the client is requesting this, and it's clear that they're requesting it for a non-sexual reason, okay, that can have a medical explanation, all right, or a psychological one. In some cases, if you're working with victims of like sexual assault, that type of thing. Dignity, again, we touched on that earlier, is the quality of being worthy of respect and esteemed as human beings. If someone stinks when they come in, if they have really bad body odor, it could be something, that they ate. It could be a medication that they're processing. It could, unfortunately, be bad hygiene. Handle it professionally. Don't make like, ew, like, talk about it. Explain to them what's happening, or if you can't handle it, like why we need to stop the massage or something. Dual relationship. All right. This occurs when a massage therapist has some other type of relationship with a client, usually like a friend or a coworker. You're like, hey, let's do tradesies. I really want a massage. Okay, you can massage me next week, and then I'll massage you like this week, kind of thing, if you both work at a spa together. But please be careful. In the US, the FSTMB is advocating for a 6-month period of no contact between the last time you gave someone a massage and when you start a relationship with them, if it's someone that you want to date. They recommend a 6-month waiting period, okay? In Canada, it's illegal. It's considered sexual abuse to massage someone that you are in a relationship with. In some cases in the States, they look at it as prostitution. In Canada, they consider it sexual abuse, even if you're married. Okay? You can't charge your spouse for massage because it's considered sexual abuse. They can't be a client of your business. Okay? You can't massage them as a licensed massage therapist. It is never permissible with a person with whom the massage therapist is in a sexual or romantic relationship, period. And it could be unethical if you have a weird power differential. Might be kind of weird to massage your boss. You know what I mean? You guys could be friends. Is being friends with your boss appropriate? Maybe, maybe not. It depends. Is it a small family business? Is it a corporation? Like, what's happening in this situation? Be very, very careful of having those kinds of relationships. We get into that later in class where we talk about things like doing massages for trades for like construction work and stuff for people. Now you have a dual relationship where someone is your contractor and they're coming into your house and they're doing work for you. But at the same time, you're doing massages for them. What if they don't like your massage? What if they do terrible construction work? What happens then? Like it's a very, it's a bad gray area sometimes. Fair and equitable access to care. I have provided a link here to a Massage Magazine article about diversity, inclusion, and equity. All right. We just want to make sure that everybody of all types, unless they're absolutely sociopaths, can come in and have a massage. All right. We don't want sociopaths because we want you to be safe. Although I guess I shouldn't say that because there are some functioning sociopaths that have not hurt people. So I apologize if you have that diagnosis. Honesty. Honesty is being sincere and truthful and refraining from any kind of deceit in the practice of massage therapy. Again, I'm not going to tell someone that I'm a cranial sacral specialist until I really restudy and repractice on probably a solid 150 people because it's been a decade, man, since I've done that work. And you got to be honest about what you are currently skilled in. Integrity, the quality of being sincere, honest, and trustworthy in making choices and decisions consistent with a massage therapist's professional values. Professional judgment is the ability to competently interpret and apply ethical, legal, and professional requirements to the unique circumstances of your practice. What does that mean? It means you know enough about the body, about the laws, about what your client needs to make an informed decision yourself. Professional misconduct is conduct that does not meet the minimum expectations of integrity, client-centered care, and professionalism. All right, you're acting like a fool in your office. Don't do it. All right. This next one, I would recommend that you pause it here and read through these. I'm going to include them on your lecture quiz as matching definitions. Okay, this is a glossary of terms on diversity, equity, and inclusion. They are all pertinent in the code of ethics because you want to treat everybody with respect and dignity of care, okay? So there are 15 here, all right? Please read them over. Diversity, ableism, ageism, what's an ally, cultural pluralism, all of these things, okay? Professional responsibility. Professional responsibility includes the duties that you exercise to your clients as regulated healthcare professionals within their professional role and commitment. All right. You know that someone that has diabetic neuropathy, you can't do deep tissue on their feet or some crazy reflexology. Their toe might fall off in your hands. Don't do it. Don't do it. If someone has a DVT, a deep vein thrombosis, you're not going to go do deep work on their leg at all. That's a whole area you're going to avoid. You don't want to cause an embolism and have your client die on the table. All right. You should know these things about anatomy and pathology, and you should know what you need to avoid to potentially hurt people. You also need to know various things about your ingredients. Don't just be ordering stuff from like all the massage magazines that'll start coming to you once you get licensed. You need to give your clients information and have informed consent before you apply stuff to them. One thing that I probably have brought up about 100 times in various classes is arnica, because arnica has become a huge thing in Biotone, especially, right? Biotone is one of the major makers of massage lotion, and they do all their heavy lavender creams and like deep tissue massage cream, and they have some fantastic products. And that is what I used to use before I started almost exclusively making my own. Um, because they like to put in arnica for healing of the skin, and faster healing of bruises and stuff, which as a new therapist, you're not going to be rubbing on hematomas anyway. But arnica, as great as it is for potential skin healing, will cause cardiovascular issues, especially things like tachycardia, like a fast heartbeat, when applied topically, because anything you put on the skin, the body absorbs. If you are using things that have carcinogens in them or untested chemicals, because massage lotion's unregulated in the United States. Like you could literally buy car oil and call it massage lotion, and it's pretty much legal, right? The FDA is not checking that. You need to let your clients know what's going on them, and you're absorbing it in your own hands anyway. So I've gone completely off topic here, as I usually do. I apologize, but it's your professional responsibility, okay, to know how not to hurt them, and including what products you're putting on their body, and by default in your own body through your hands. Scope of practice. All right, practice of massage therapy includes complementary methods, including the external application of water, heat, cold, lubrication, salt scrubs, body wraps, or other topical preparations, and electromechanical devices that mimic or enhance the actions possible by the hands. Yes, but no. So like in Florida, where I was licensed, we could use ultrasound, we could use cold, uh, cold lasers. We could use TENS units, things of that nature. You cannot in Michigan. You can potentially use a massage gun. However, you cannot use things like ultrasound or TENS units, to my knowledge, looking at the state laws of Michigan as a massage therapist. So please keep that in mind. Therapeutic relationship. It is the professional relationship that you have as a massage therapist with your clients. All right. Obviously, it's designed to promote, support, and advance the health and best interest of the client only, and is grounded in trust, respect, and the appropriate use of your knowledge and power. Therapeutic touch is physical contact between a massage therapist and client for clinical indications within your scope of practice. Can't pop a pimple. You're not going to pull out a tool and remove a blackhead. You're not going to try to diagnose a mole. None of those things. All right. You're going to stick to your scope of practice. Transference and countertransference. We're going to cover this in the chapter. Just know that transference refers to a client's feelings about another person that they sort of project onto the therapist. Okay, like maybe the therapist looks like their aunt that passed away when they were little, and they're like, oh, I miss my aunt, you remind me so much of my aunt, and you laugh like my aunt. And then the client starts thinking of the therapist like their aunt. Or, like I said before, transference, the client may mistake the intimate settings of a massage therapy office for something perhaps romantic or sexual in nature. Countertransference is when the therapist has feelings about the client because they remind them of someone else. And this will impede the therapist's ability to be fully present for the client. What if the client reminds them of an uncle that was really abusive and nasty? Like, are you going to be completely open and as friendly with that client as you are with other clients? Probably not, because you feel uncomfortable subconsciously. And then that starts to show in your conscious actions, whether you know why it's happening or not, until you start thinking, oh, this client reminds me of this person. You need to nip that in the bud. If you were unable to overcome those feelings, you need to sever client-therapist relationship. Transparency is the quality of being open and honest. All right. You can pause here. This is for your benefit. It is just referring to the unprofessionalism of gossip. We're all adults here. Clearly, you're an adult if you're taking this class, or you will be a fully legal adult by the terms of what the United States determines to be an adult in the state of Michigan in order to get a massage therapy license. You should know what gossip is. This includes sharing things on Facebook and Twitter, not just talking to your coworkers about a client, and not just talking to a client about another client or about your coworkers or about something else. It's unacceptable. Don't do it. Don't talk about people whatsoever. All right, confidentiality. A client's information, both written and verbal, belongs to the client. I know we talked about confidentiality before, but again, it's super important. It's also the law. All right, revealing information about a client violates privacy. Whatever is shared within a session is intended to stay there. Now, if a client has signed a form stating that you can give information to their insurance company, their doctor, other health care team members, or maybe like a spouse or emergency contact, you can share that information with those people because you have signed informed consent in order to do so. Otherwise, lips are sealed, okay? Mutual respect. It is unethical to imply that your skill level or method of therapy is superior to either another practitioner's or another type of body work. We are not going to shame acupuncture that has been around just as long, if not longer, than massage. We are not going to shame another therapist, even if we might privately think that that therapist is ridiculous and doing something. We'll talk about harm in a minute. That's a little bit different, but you wouldn't be sharing that necessarily with the client. You are not going to chat openly with clients about your skepticism of aromatherapy or chiropractic or orthopedic surgery, that type of stuff. I will say I've been right on that border sometimes because I've worked with a ton of clients that have been diagnosed with carpal tunnel syndrome when in fact they had an issue with their brachial plexus. And a lot of clients have been saved from having to have carpal tunnel surgery by having their forearm up through their neck properly worked by a manual therapist like massage therapy. And then those that didn't do that and had the carpal tunnel surgery ended up having scarring inside of that tunnel because of the surgery, which just caused more actual carpal tunnel this time that they didn't actually have to begin with. So I've skated that because I've really talked about getting proper assessment and proper manual work done before getting carpal tunnel surgery. But I cannot say, hey, don't get the surgery because I can fix this with massage, because that may not be a true statement, but it's certainly one that would be out of my scope of practice to say. All right. Your client may fully believe in the power of essential oils and may be like 20 levels deep in some pyramid scheme to sell them. Let them go with it. All right. Oils can absolutely help in some cases and absolutely hurt in others. It is not your place to tell them that it's silly, though, if you haven't done the research yourself, or if it's just a personal opinion that you have formed. Please don't do that. Reputation. Careless gossip can damage an innocent person's reputation and affect their livelihood. All right. Aside from being unkind and unethical, it opens you to slander suits from the accused. So don't talk about like the chiropractor that I worked for that had a they used to sign forms underneath my name claiming that I had done twice as many units as I had on clients to steal from their insurance company. No, we can't give their names and talk about it openly because I could be sued for slander, even though it's true. Okay, you can't do that. You can't give those details away. Naughty, naughty. You don't talk about other professionals. All right. The exception to silence. All right. There are times when it is appropriate to talk about it. It's not just gossip anymore. If you believe that another therapist has behaved unethically or illegally, you can absolutely report them, and you should, to their employer, to the board, to the state. All right. get it reported so that they're not actually hurting other people. Again, avoid gossip. It's human nature to use dialogue for connecting to other people. All right. And the intimate nature of body work really invites informal chit chat. I mean, they're face down. You're not even looking at them. You're already touching their semi-nude body. Like it feels like a very close, personal connectedness that you have with this person. And you can make the mistake, and they very often make the mistake of oversharing. All right. You might want to pause here and look that there are 4 tests that your words should pass. I'm not going to test you on this, but if you are someone who tends to gossip, maybe check these out. All right, that is all I have for you guys today. I apologize it went longer than I wanted to, but this is an important topic. Please always remember, if this was painful for you to go through, you can absolutely change the speed of the lecture to like 1.25 or 1.5 to make me talk a little bit faster through these things. I promise you the things that I'm telling you do show up on the NBLEX, and they're absolutely vital for your future career. I promise you. I am not trying to waste your time, no matter how many tangents I accidentally go on. All right, everybody have an excellent day, and I will see you tomorrow.